Assalamu alaikum dear students of 11th class. Today our topic is physical examination of the patient. So what is the introduction of physical examination of the patient? A comprehensive head-to-toe assessment is done on patient admission or in community center, and when it is determined to be necessary by the patient health status. The head-to-toe assessment includes all the body systems and the findings will inform the health care professionals on the patient overall condition. Dear students, head-to-toe examination or assessment is done on patient admission. It is necessary to determine the patient's health status. And students, head-to-toe examination means all the body systems and all findings will inform the healthcare professional regarding patients' overall condition. So dear students, what is the physical examination of the patient? It is the systemic collection of objective information that is directly observed or is elicited through examination technique. Dear student, it is a systemic collection of objective information, or it is the routine test your primary health care provider performs to check the patient overall health. Okay. Dear students, the performing primary care provider may be the doctor, maybe nurse, practitioner, or physician assistant. And students make sure that the patient does not have any medical problems that he or she is unaware of. And the examination, this physical examination is also known as the wellness check through examination techniques. Next is the purposes of physical examination. Dear students, to understand the physical and mental well-being of the patient. So when we are attending the patient, we should understand the physical and mental well-being of the patient. Okay, and to detect a disease in early stage. Dear students, check for possible diseases so they can be treated early. Next is to determine the cause of disease. So we can detect early the cause of the diseases when we are doing the physical examination of the patient. Next is to determine any change in the condition of the disease and any improvement or deterioration. Dear students, when we are doing the physical examination of the patient, so we will check any improvement or change in the condition of the disease. Next is the articles. Which article should be required for doing the physical examination of the patient? First is gloves. Gloves, when we are attending the patient, we should wear gloves for doing the physical examination of the patient. Sphygmomanometer is the next. Sphygmomanometer is used to check the blood pressure of the patient. Stethoscope is also used to check the bowel sounds and heart rate. Okay. Next is the flashlight. Flashlight is also used in physical examination. Next is the watch. Watch is very important when we are doing in physical examination of the patient. Next is the scale with height measure. Pulse oximeter. Pulse oximeter is used to detect the pulse of the patient, to detect the heart rate of the patient. Okay. Next is the lubricant. Lubricant gel is used to detect use it in patient to prevent friction. So dear students, next is the techniques of physical examination of the abdomen, and these are also known as the methods of physical examination of the abdomen. First is inspection, next is auscultation, percussion, palpation, and spatial tests. Dear students, first is inspection. Inspection is the visual examination of the patient, systemic visual examination of the patient, or it is the process of performing deliberate, powerful observations in a systemic manner. And dear students, it involves observation of the color, shape, size, symmetry, position, and movements. And general inspection of the patient focuses on the overall appearance of the health or illness, signs or distress, facial expression and mood, and body size, grooming, and personal hygiene. Okay, this is the inspection. Next is the auscultation of the patient. What is the auscultation of the patient? A physical examination. Auscultation is the abdominal examination performed for detection of altered bowel sounds. Okay, and it is the process of listening to sounds that are generated within the body. Auscultation is usually done with the help of a stethoscope, and the heart and blood vessels are auscultated for circulation of blood. The lungs are auscultated for moving air. This is the auscultation. And dear students, next is the palpation. So dear students, palpation is the use of hands. It is the use of hands and fingers to gather information through touch. It is the assessment technique which uses sense of touch. It is a feeling the body or a part with hands to note the size and positions of the organs. And its students, the hands and fingers are sensitive tools and can assess temperature, texture, moisture, vibration, size, position, consistency, mass, fluids. Okay, so dear students, you are the general duty assistant, so you should use the dorsal surface of the hand and fingers and use it to measure temperature. Dear students, you are the general duty assistant, so hands should be warmed and the touch should be gentle and respectful. This is the palpation. Next is the percussion. Dear students, percussion, it is the examination by tapping the fingers on the body to determine the condition of the internal organs by the sound that are produced. Percussion is the act of striking one object against another to produce sound. So this is the percussion. Dear students, this was the techniques of the abdomen or methods of physical examination of the abdomen: inspection, auscultation, percussion, palpation, spatial tests. So dear students, spatial tests like lung function test, kidney function test, etc. So this was all about our today's topic. Thank you.